I'll just start off as more people keep joining in. So thank you everybody. On behalf of EldersIndia, I'm Rima Bose-Suri, who leads client engagement for EldersIndia, and I am delighted to welcome all of you to today's awareness session. As you are aware, September is celebrated as World Alzheimer's Month, and we at EldersIndia have partnered with Alzheimer's and Dementia Rotary Action Group and Rotary Club in trying to help them spread awareness around dementia and Alzheimer's to the larger community. So while we are working very closely with corporates, we are also trying to do a lot of work in the area of building awareness around elder care needs and really the expectations that elders have from the community. How can we help enable that in the larger community? Today, we are delighted to have with us Dr. Sushma Shukla. Dr. Shukla is the founder and president of 𝒊𝒔𝒂𝒓𝒆, which is an NGO creating awareness.
I'm Sushma Chawla.
Sushma Chawla, sorry, I'm so sorry. 𝒊𝒔𝒂𝒓𝒆 is an NGO creating awareness around dementia and Alzheimer's. I'm going to invite K.S. Raghunandan, the founder and CEO of EldersIndia and 𝒐𝒄𝒂𝒓𝒆, to start with a brief introduction about Dr. Sushma and a little bit about EldersIndia, and then we get into the discussion. The flow is that we've requested Dr. Chawla to speak a little bit and share a little bit more about the disease of Alzheimer's and a few things that each of us should be aware of, and then we will get into a Q&A session with her. Over to you, Raghu.
All right. Good morning, everyone. Thank you, Rima, for that introduction. Welcome you all to this webinar, and thank you for joining this Saturday morning. And as you just heard, September is Alzheimer's Awareness Month. Worldwide, over 55 million people have Alzheimer's and dementia, and over 60% of them are living in low and middle income countries. India is reported to have at least 6 million patients, and this number is only going to grow up significantly, tripling by the year 2050. WHO recognizes dementia as a public health priority. Alzheimer's and Dementia Rotary Action Group was set up to address this challenge. It's a Rotary Club initiative to spread awareness of this disease and support the communities and caregivers worldwide to better face this situation. In India, ADRAG the Alzheimer's Dementia Rotary Action Group has been set up with Rotary Club Bangalore Cantonment as the lead club. I acknowledge the support of that club. ADRAG India is chaired by Wing Commander Sabharwal. I hope is able to join. And ADRAG India brings you this webinar in partnership with EldersIndia and Rotary Club of Bengaluru, Pune and Gateway. I acknowledge the presence of its president, Govindarajan Kannappan. Thanks, Govind, for joining. Today, we'll focus on understanding more about this disease. What is it? How do we identify? What can we do once you identify? How can we prevent, etc.? And we're really privileged to have you, Dr. Sushma, with us to enlighten us on this topic, and welcome you once again for the webinar. Dr. Sushma is a medical practitioner for the last 43 years. She is the founder president of 𝒊𝒔𝒂𝒓𝒆, which is an NGO for the care of elders with Alzheimer's and dementia and their caregivers through its dedicated team of medical professionals and volunteers. She herself has had the experience of caring for her mother when her mother was diagnosed with Alzheimer's. Dr. Sushma, thanks once again. Request you to give us a quick overview, post which we'll take up the questions. Over to you, Dr. Sushma.
Thank you. A very good morning to all of you, and thank you for inviting me for this talk amongst the people and creating awareness and understanding dementia. I'm a medical practitioner and into this field of NGO dedicated to the care of Alzheimer's disease patients. and their caregivers, because the caregivers need care. And we are also being awarded special consultative status from United Nations, their Economic and Social Council. And we have been working in this field for the last 21 years. Though those with Alzheimer's disease might forget, they might forget themselves, their family members, and they might even forget us. But we as a society must remember them. That is very, very important. And we should be empathetic towards them. So we start about dementia. Aging is inevitable. You have to, if you are born, you have to age. And there comes an age where you finish your responsibilities, you retire from your job, and then old age comes in. That is post 60. Now the old age is post 80, but going to the earlier standards, yes, 60 plus, you start having various ailments. Your vision diminishes, your hearing diminishes, your hair loss is there, wrinkles come on the face, and suddenly when you look into the mirror, you realize that you are growing old. You develop osteoarthritis in your knees. There is reduced mobility that further depresses you. There are urinary issues due to prostate enlargement and due to menopause in women. There is financial insecurity because you lose your job. And there are various reasons of financial insecurity. I'll not go into details of this. And most important is the loneliness. If the spouse goes away, you're absolutely alone. And lucky are those who have their children and families living nearby. But the globalization have really forced the children to move away from their families. Aging also comes with forgetfulness. You must all have realized that slowly you start forgetting. Where have I kept my keys? Why did I come to the refrigerator? And why did I come to this room? Now, looking into this forgetfulness, a question comes in. Is it old age or is it dementia? You all must have heard about dementia, and dementia usually strikes at old age. So then the biggest symptom is memory loss. Okay. And you suddenly start wondering, am I getting old or am I having dementia? So very briefly, I'll put in here the signs of normal aging and the early signs of dementia. You forget the names of people you rarely meet. अब कोई अगर cousin 4 साल बाद आएगी अमेरिका से जिसको आप कहीं मिले नहीं और वो बोलेगी मुझे पहचाना, हाँ, तो you might forget her name, but you know that she is your cousin. But dementia people, they forget the names of the people with whom they are staying. That's the biggest difference. Briefly forgetting about the experience, like you went to a picnic and you suddenly forget what happened there and then you recall. But in dementia, you forget things more often than the normal people. Elderly people don't have any strength in them, then they put away their things inappropriately and they don't tidy up their almirahs. But putting the things inappropriately is a warning sign of dementia. Mood changes in response to a cause. If you have done something and the person is getting angry, okay, that is a cause. But unpredictable mood changes, it might be dementia. Changes in their interest in old age and decreased routine in activities and difficulty making choices, which shirt to wear, which pant to match. These are the early signs of dementia. What is dementia? It is an irreversible neurodegenerative disorder of the brain affecting your memory, thinking skills, reasoning, and poor judgment. It is not only memory loss. It is your thinking skills, your reasoning, and your poor judgment. And it affects your daily life. Everyday life it is being affected, and it robs you of your personality. Now you will ask me, what is the difference between dementia and Alzheimer's disease? Dementia is an umbrella term. It is an umbrella term. And there are various cognitive diseases under it. Like most common is Alzheimer's disease, which you keep hearing in your newspapers and in your other stories also, because this is the most common form of dementia. Then people have vascular dementia, those who have brain stroke, and they get vascular dementia. Dementia with Lewy bodies. There are various collections at the nerve junctions, and small structures they form if they see it in the MRI. That is about 10 to 25%, and frontotemporal dementia is rare, but frontotemporal dementia associated with Alzheimer's disease is very common and very difficult to manage also. This is just a cross section of the brain. If you look at the area of the memory in a normal scan, what happens to the brain? The brain shrinks. Brain also shrinks in normal aging also. But the various areas shrinking fast and affecting your memory, your thinking skills, your language, your activities of daily living, that is the sign of Alzheimer's. Though a brief history of Alzheimer's, it was identified 112 years ago by a German neurologist named Alois Alzheimer. And there was a patient, Augusta Decker, in his ward who had different symptoms, different behavior, and he was unable to diagnose that why she is showing this different type of mental illness. After her death in 1906, he did a biopsy and found that her brain, there were various tangles and plaques in her brain. Plaques means there are collections, and tangles means just सारी nerves जो हैं ऐसे उलझ जाती हैं. And this was identified by Dr. Alois Alzheimer, and that is why the name. Incidence of dementia, I'm talking in India, not worldwide. There are more than 5.4 million people suffering from dementia in our country. The figure is not up to date. Reason being that most of them don't even report due to stigma attached to it. Incidence is 1 in 20 after the age of 60 and 1 in 5 after the age of 80. Why you are seeing more cases of dementia these days? Because the longevity has increased and India is aging faster. According to the United Nations Fund for Population Activities, overall population of India is expected to grow by 56% by 2050. But the 60 plus population, that is the area which we are identifying, is expected to grow by 326%. And India is not prepared to face this great tsunami. Delhi has approximately 7 lakh persons with dementia. And every 3 seconds, somewhere, someone in the world is being diagnosed with dementia. So it's a very serious matter. Dementia can be reversible and irreversible. Earlier I said that it is an irreversible neurodegenerative disease. But in some cases it can be reversible if it is due to dehydration, hypothyroidism, vitamin B12 deficiency, and post-surgery after anesthesia. But it is irreversible after stroke, cerebrovascular accidents, Parkinson's disease, and head injury. These are, very briefly, I'm telling you the early symptoms of Alzheimer's disease. which a common man can also identify amongst their family, friends, and relatives. There is impaired memory, which is attributed to old age in most of the cases. We have tried to catch the people with impaired memory so that we catch them at an early stage, that is MCI stage, mild cognitive impairment. It is not only the memory, there is disorientation of time and place, confusion with day, month, and year. Misplacing things in inappropriate places, personality changes, they don't like to dress up, कंघी भी नहीं करना चाहते हैं, कपड़े भी नहीं बदलना चाहते हैं. Poor judgment and abstract thinking. कि अभी मेरा नलका लीक कर रहा है, मुझे अब इसको क्या करना है या क्या करवाना है. Problems in language and communication, problems in performing familiar tasks like cooking, putting masalas in the dish, or dressing up. Loss of normal sleep pattern, they sleep more during the day and they wake up at night. Loss of initiative and withdrawal from social activity. Because they lose the word, they lose communication. So their ego is the most important thing, their dignity is most important, and dignity goes last. It goes with the death only. So to maintain their dignity, they withdraw themselves from social activities, wandering and getting lost. Raghu, any problem with the language? Do you want me to mix up Hindi with it, or English is okay?
Whatever you feel comfortable. I think most of us
I'm comfortable.
understand.
I'm comfortable.
Yeah. Let's go ahead with English, and wherever you feel it's natural to kind of mix Hindi, please go ahead and do that. I think most of us understand.
Okay. So you can note down 5 A's of Alzheimer's disease. First is amnesia, memory lapses. You suddenly forget who is there or what is his name. Then there is apraxia, difficulty in doing simple tasks and movements. Like I have to get up and go to the bathroom. Aphasia, problem with the language. कि मुझे क्या कहना है. Agnosia, finding difficulty in using the common item. Bathroom में जाएंगे, brush पकड़ेंगे, and if they don't know what to do with it, that is agnosia. Anomia, find difficulty in finding common names of the things. If they're holding a shirt, they will not be able to say that this is my shirt. So there are various, I will not go into the pathophysiology and the various details. And one common example I'll give you. You all must have seen ladies knitting, and ladies must have knitted. So if you're making a ball out of wool, and you just leave it and somebody comes and puts the ball here and there, when you try to straighten it off, you will see that it is all entangled. So this is what happens to the brain in Alzheimer's disease. And you are not able to find the end. Similarly, they are also not able to find the right words and right conversation and the right direction. The main risk factor of Alzheimer's disease is age. And very fortunately, due to increasing quality of medical aid available to people at fairly affordable costs, insurances and everything, people are living longer. Incidence stands at 1 in 20 after the age of 60 and 1 in 5 after the age of 80. And beyond that, 1 in 3. Diabetes mellitus is the most important risk factor. Uncontrolled diabetes damages the brain cells. Hypertension, of course, leads to various strokes and other diseases. So after hypertension comes stroke. You damage your brain cells, and that is a risk factor of Alzheimer's disease. Dyslipidemia, that is high cholesterol levels and high triglyceride level. Sedentary lifestyle, you just don't move and keep sitting in your couch. Family history of dementia, yes. In very few cases, marginal cases, yes, this is hereditary. And mostly the females are affected in this. And various genotype studies are coming in. If you have somebody in your family suffering from dementia and you doubt that this might be carried on, there are various gene tests and you can get them done whether you are at a risk or not. But familial dementia always comes early. It comes around the age of 30 to 40. Old age dementia is usually not hereditary. Unfortunately, no specific treatment is available as yet. How do you establish a diagnosis? Now you see your loved one having all these symptoms. Now how do you establish a diagnosis? And where do you go? You're lost. And first of all, don't rush to a super specialist. Contact your family physician because he knows what type of person you are and what type of a family history you have and what are your environments. Vitamin B12 levels are to be checked because B12 helps in the conservation of the nerves. Neuropsychologists should be contacted for memory assessment, whether you are having memory lapses which are due to a disease or just due to your depression. Then the neurologist should be contacted. He will advise you MRI and PET scan. Psychiatrist, if advised, for the behavioral symptoms. But the compassionate caring is the key to managing the dementia. Unfortunately, no treatment, no specific treatment is available to cure this disease. जैसे आपने एक टैबलेट खा ली और आपका कोलेस्ट्रॉल लेवल कम हो जाएगा और आप ठीक हो जाएंगे और थोड़ी देर में आपके डॉक्टर थोड़े महीनों बाद इसको हटा देंगे. अल्जाइमर्स के लिए ऐसा नहीं है. Medicines are available to slow the process of degeneration of the brain if given at an early stage. Recently, one medicine, ADRAG, has been studied in USA, and it is aimed at changing the underlying biology of the disease. Therefore, the progression of the disease might change and people might have a quality life. Medicines are also available to manage the behavioral and psychological symptoms. But again, I will repeat, compassionate caring is the key to managing with persons of dementia. Now, caregivers are the persons who care for the persons with dementia. And they are the lifeline of dementia patients. Most important people are the caregivers of the patient. Most difficult tasks, they get exhausted, their burnout is very rapid, and they try to do their best. Family-based caregivers are primary and often the only support system for these patients. Lack of awareness, because the diagnosis is, therefore the diagnosis is made very late. Because if we do tell them that he's losing his memory, they will just shove you away and say that, no, it is due to old age. And everybody forgets in old age. Now, here I would like you to note down one thing. A family I met, they said that, I said, he is losing his memory and you please take him for his further diagnosis. They says, कैसे memory भूल रहे हैं? अभी जो ब्रेकफास्ट खाया है वो तो भूल गए हैं, लेकिन वो स्कूल कौन से गए थे, उनकी शादी में कौन कौन आया था, उनके बेटे की शादी कहाँ हुई है, उनका ग्रैंडसन कब पैदा हुआ था, बच्चों का बर्थडे, सब कुछ याद है, तो मेमोरी कैसे खराब हो गई? And they don't take them to the doctors. Now here I would like to specify that early memory is, recent memory is affected. The late memory continues and remains intact, sometimes even just before the death also. Lack of dementia-friendly community. We are not very friendly with the dementia patient and their caregivers. Therefore, a lot of stigma is attached to this disease. Lack of training. How do you manage such patients? Prone to psychological distress, the caregivers. Children performing caregiving are not given due family and social recognition. The only remark they get is, तो क्या हो गया अगर कर रहा है तो अपनी माँ के लिए ही कर रहा है ना. They are not given due social and family recognition. Often elderly caregivers, like if it is a spouse, they are suffering from many ailments themselves, especially the spouses. And they also need help. Legal issues are there, a lot of legal issues. And all these things should be tackled at a collective level. How do you communicate with an Alzheimer's patient? The caregivers, they ask me, कि इनके साथ बातचीत कैसे करें? Now, before they lose their communication skills, you start their treatment, take him to a doctor. But if that is not possible, when he comes into the room, there should be no distraction, no music, no TV. If you want to talk to him, sit at the level of patient. ये नहीं कि वो पलंग पे बैठे हैं और आप नीचे बैठ जाएं. Maintain eye contact with him. Absolutely straight eye contact. Speak clearly and very slow. Hold their hands to have their attention. Very compassionately hold their hands and don't ask, इसको पहचाना. अगर घर में कोई आ जाता है तो उनको मिलना चाहते हैं, सपोजिंग बुआ को मिलना चाहते हैं, तो ये जाके कहना कि मम्मा आपने इसको पहचाना. She'll be lost. And her brain will be working at the speed of 150. Give clues and simply name कि मम्मा देखो बुआ आई है. So they will get a clue and then they will start the conversation, maybe to a little extent. That healthy conversation will give you respite, will give the respite to the visitor, and it will give some dignity to the patient. Bathing and eating times are very tough for the caregivers, and there are various things which you can do with all these things. Try to keep their brain active with various activities. Add music to their lives. I'll just show a very small video of the Alzheimer's patients at my daycare center in Delhi, that how they have, we give them a sheet having the words of the song. Every Thursday, a musical teacher comes in, she's a professional singer, and we sing with them, and you just see how nicely they are singing. I'll just put on the video. It is only for 38 seconds. These are all Alzheimer's patients who are sitting around the table and in early and moderate stage. And they're almost 2 months into this musical training, and they're all singing. You have seen them, you know, they're all participating in this class. Burden of caregivers is immense. They are loaded with various issues. Now, what can we do? We can do to prevent this disease. Add music to your daily life. That is very, very important. Socialize with your friends. Even if you are seeing that there is some memory lapses, still you socialize with your friends and tell the friends that there are some memory lapses, but please help me. Learn something new as you finish your job responsibilities, like you retire, and start knitting, learn harmonium or learn guitar. Manage stress. We are just a call away. Avoid depression. There is a very thin line between depression and early signs of dementia. Morning and evening walks, they always improve memory, improve muscle toning, and they improve the brains also. They reduces joint pains, you are more mobile, reduces the diabetes risk, strengthens heart and brain, and improves your immune system. Do various aerobics like Sudoku, very important, and use your less dominant hand. If you're a right-hander, use your left hand at least once during the day. Minimum, if you write with your right hand, start writing with your left hand 1 page a day. That will stimulate your brain in the other hemisphere. Change the route while you are driving. Like if you are driving from A to B every day from home to office, that route is just fed in your brain, and you can automatically go there by closing your eyes. But if you change the route, you will think whether I have to turn right or left, and that is what we want the brain to do. Think and apply. Eat walnuts and eat other nuts also, and solve a lot of puzzles. You can come and visit our place. We give them, you will find them on internet also, and have a very healthy diet. Very briefly, I'll tell you what we are doing. 𝒂𝒂𝒂𝒂 activities, we are still creating mass awareness, because that is very essential. People are aware of this disease, but yes, it is still a lot has to be done. This picture you can see, we recently did a mass awareness campaign on metro station. We pasted these posters on 30 metro stations in Delhi, stating the differences between dementia and normal age. Go to a memory assessment clinic or go to a medical assessment camp where we are doing medical memory screening also. We give training to the family caregivers. If the caring of a dementia has been put on them, well, they have to learn how to cope up. Training to the professional caregivers. Online support to the caregivers from my WhatsApp group. We have 100 plus caregivers on that group, and every day somebody or somewhere in the world is facing some challenges, and our group is so active. They just give us solution. Some of them are still caring, some of them have cared. This is the address of our affectionate, secure home for Alzheimer's. We provide residential care services, daycare services, and during COVID, we started Hope at Home services. We went online. So look at these daycare activities, clapping and dancing. We don't make them stand and do the exercises. We play carom with them. These are all structured every day by our care coordinator, and we do these activities as per the schedule. This is my team, very dedicated, my angels. Always remember, happiness needs no age. It just needs people around you. Thank you very much for a very patient hearing.
Thank you. Thank you so much, Dr. Sushma. It was a very, very comprehensive overview of what one needs to know. There are a few questions, but maybe let me just start with asking you one, if you're okay. You mentioned that it's a disease of the brain, right? That's
I mentioned It is now
Sir.
seen in youngers also, family genetic dementia. But usually, yes, it is a disease of adults.
Disease of the brain, I meant.
Yes.
So for most other parts of the body, there is always a reason. Either you're not exercised or use that part, or you've had some excessive use, there's more wear and tear, or it's related to diet and so on. For the brain, is there any correlation between using it more or less? In other words, are there some professions more at risk than the other?
Sorry.
Should I repeat the question, Dr. Chawla?
Yes, yes.
Okay. Now, what I meant was, for most of the other diseases, there is a direct correlation most of the times between, overuse or underuse of a product. For the brain, is there any correlation between using the brain more or less? In other words, are some professions more at risk for this disease than the other?
Yes. Basically, there is a statement, use your brain or you lose it. Okay. But I have seen people in active service using their brain. They have been professors, and during their job only, they develop the Alzheimer's disease. Yes, you have to enjoy your job. You have to enjoy your work. And if anything gives you stress, even your work, if it is giving you stress and it is not keeping you happy, you please consult a counselor that I am not happy at my work. What should I do? You cannot change the job so frequently, but yes, you can change yourself, your attitude, and remain happy and positive in the same work atmosphere. That is the best you can do. Otherwise, who is at risk? Mainly the people who are not having good sleep, like these shift people. They are working day in and day out. They have reversed their biological clock. And in the later years, they will be more at risk of developing dementia. Because brain needs two things: good food and good sleep. You take good food, give oxygen to your brain, move around, and give good sleep to the brain so that the cells, they regenerate themselves. But if you will keep tiring your brain cells and don't sleep, it will be a risk factor. I'm worried about the call center employees. They are young, they can do that. But what about when they reach 50 or 60? You should be prepared for them also.
So quality of sleep and the stress levels. And then you also mentioned use it or lose it. Just a quick question, since this seems to affect elderly more, relatively speaking, is it possible that retirement, when the activity level potentially reduces, whether that's of the brain or physical exertion, does retirement also have something to do with increasing the chances of getting the disease?
Yes.
Okay.
People are, slightly worried about their finances, number one. They become more lethargic. Ab to office nahi jana, to aaram se baitho. They become lazy towards their diet also. The office to bhag ke nashta kiya, abhi aaram se baith ke parotha khayenge. So, well, that can be taken up for a week or 2 weeks, but not as a routine. One should be as active in retirement as one was during the job, and take retirement as a normal happening, normal incident in your life. Don't take, because once you join the job, you have to retire at 60 or 65. So be prepared for it, regarding your finances, regarding your home, regarding your family. One should be prepared for it and prepare well for it.
I take this
Dr.
opportunity
Sushma,
of.
may I
Yeah,
just
I was
comment?
just. Yeah, please go ahead, sir. Before you come in,
Okay.
I just wanted to acknowledge the presence of Wing Commander 𝒊𝒏𝒄𝒂𝒓𝒆 is the chairman for ADRAG India. So happy and privileged with your presence, sir. And just to let you know, those who are attending, we are having a detailed session next week on this subject with a lot more focus on caregiver, which 𝒊𝒏𝒄𝒂𝒓𝒆 will be presenting. Sorry, sir. Please go ahead.
No. Raghu, Dr. Sushma has clearly said that lack of sleep and certain stress is there. But let me say from my experience, my wife was a postgraduate teacher for about 25 years. She was teaching yoga to about 100 ladies. She was trained by Ramdev. Still, she got it at the age of 52. Last 1 year, 3 of my Air Force colleagues, senior ranks, those who had retired, who were still directors of various companies and all that, they got it, right? So I think, to my mind, unnecessarily, you should not worry that it affects a particular profession. As she said, call center is a very specific thing where the sleep pattern is disturbed. Otherwise, I think it hits anybody from any profession, and even the people who are using their brain. Yeah, one is right. Don't use it, you can lose it. But those who are using it, they are also been losing it. I mean, I'm party to 4 of them in the last so many years. So it's don't worry on that, but yes, keep on using your brains. I hope Dr.
Yes.
Sushma would
Yes, I
support what I'm
agree
saying.
with you.
Yeah.
I support you and I agree with you. Dementia can knock at anybody's door. And people who are not using their brain or who are not leading a healthy lifestyle, well, they are more at risk, I can say.
Exactly.
But even those people don't get dementia, and active people do get dementia. So it can strike at anybody's door.
Okay, understand. So this is a little more complex than
yes, it is
one
complex.
thought.
Yeah, it's
So you mentioned how it can be detected, right? Regardless of what the underlying causes are and what one needs to do when the symptoms arise, right? It was obviously very helpful. But somewhere I had read that the changes in the brain are set to begin several years before, something like 20 years or so, before it actually gets noticed by the person or the people around the person. So is there anything that can be done during this period? And if so, what it is? I was just wondering whether, everyone who's, let's say 60, should we just get a brain scanned and see if there are early warning signs?
No MRI, no PET scan as a routine. But yes, if you do feel that there is any sign of memory lapse, immediately get your memory assessment done by a neuropsychologist and go towards, treating that. In Canada, they are identifying disease at the MCI stage, that is mild cognitive impairment. And for Alzheimer's disease to come in and show frankly, it takes about 15 years. If a person of 70 years is showing mild cognitive impairment and you identify it and you can manage it, I think at 85 or 95, frank Alzheimer's may come, may not come. That's a good number of years. So let him live good quality 15 years once he's diagnosed with MCI. Here I would like to mention that we are all in denial as a society and as an individual also. We don't want to talk about this disease in society, in family, and in person also. The first thing is that we should throw the stigma away. Create awareness. And awareness is not only in the month of September. It has to be done every week at different places. And then people will know that this is the disease. This is how it will manifest, and we should arrange for their early detection. And memory screening is the only tool which can lead to early detection, you know. And if memory assessment shows a little high score, it is just an oral test, little high score, you go in for further assessment, MRIs, PET scans, and see if there is degeneration in the brain, and start the treatment. Start his new cognitive retraining, cognitive rehabilitation. That is very, very important. We are doing cognitive retraining and rehabilitation at our center, and people have retained their memory with whatever they had 4 years back. They have started remembering the names of the people whom they are meeting every day. So
Wow.
it affects, I'll tell you how. This brain cell dies, okay? There is, this is not the single brain cell. There are trillions and millions of brain cells around that. तो अगर ये खराब हो गया, इस एरिया को अगर आप स्टिमुलेट करेंगे, तो the brain cells around it will get that, catch that stimulus and start taking up the task of the dead cell.
Oh.
So we have to understand the mechanics of the
So
neurobics.
is it like the bypass in a
Yes.
normal situation?
We are aware of the heart bypass,
Mhm.
but we don't even want to understand the neurological bypass. डे केयर सेंटर में लाना, उनको वहां से उठाना, it is such a stigmatized process in our society, and not only in our society, even in the West, the stigma is there. So we need to break that, and together we can do it. And as Indians, yes, we can do it.
There were a couple of audience questions. Raghu, did you
Sure.
get them?
Go ahead, Rima.
Okay, so Dr. Sushma, you also talked about it being a genetic disease. So one of our audience wanted to understand that if it is hereditary, can it also start showing symptoms at an early stage? So even in a 30, 35-year-old, you
Yes.
think forgetting
Yes.
words or doing some actions like that can indicate signs of Alzheimer's or dementia.
Yes, yes. We have seen Alzheimer's disease patients at an early stage. That is known as early onset dementia. And it usually comes around 30, 35, even 28 also I have seen them. And people don't take them seriously. कि नहीं ध्यान से नहीं पढ़ता होगा इसलिए इसको ये प्रॉब्लम आ रही है. So yes, early onset dementia is there, as I mentioned earlier also. If you have somebody in your family, please go in for your genetic counseling. They will identify that chromosome or that part gene, which will further hamper your further generations, you know. It is a very complex study, but yes, it is hereditary, and in a very small fraction of cases, hardly 2 to 3% of cases. But early onset dementia starts around 30, 35. I have a patient who is now 60. She started her dementia at the age of 35, and she continued with no diagnosis till the age of 53. And when the behavior symptoms came in, then she was diagnosed with frontotemporal dementia, familial dementia. Her mother has it, her sister has it, her other sister also has it. It is more predominant in females.
And Dr. Sushma, you mentioned about the organization you are running where you provide daycare. Are there similar organizations in different parts of the country? Is one part of the question. And second, is there also any support available for home care? As in, are there people, experienced people or experts who provide any form of home care for such patients?
Yes, we do have daycare services in Delhi, and I'm sorry to say we are the only ones who started this long back. About 6 years back, I started it, and now we are more structured because we have got a space. And recently, one more place has been identified. But yes, they are not doing it up to the level which we are doing. I'm proud to say that, but yes, we are doing it, stimulating their brain, various areas of brain. And what was the second question?
Are there any
Care.
for
Home care. Home care. We are tying up with some agencies to provide home care for dementia patient. Honestly telling you, there is not a single caregiver you will get in the market who is trained in dementia care. Because every patient is different, every patient's environments are different, and their nature is different. So the one shirt will not fit others. One size fits all doesn't help in Alzheimer's disease patients. So they have to be trained. What I suggest to my caregivers, if they need home care, we give them the lead from an agency that you hire somebody from here because they are verified people. You see the comfort of the caregiver and your loved one. If your mom likes this girl, okay, fine. Only liking, and she likes her demeanor and her body language. Then we train the caregiver according to that patient. We call that caregiver at our center. We give a training for 10 days and request the family to manage the patient as they were doing it earlier. And if they are absolutely fine, they are mobile, we ask these caregivers to send the family to send their caregiver along with the patient for the daycare. We'll train the caregiver, we'll take care of the patient, we'll give you some respite, and maybe you are able to care for them at home. The patients who are bedridden, they only need end-of-life care, and they don't need any brain stimulation or any cognitive rehabilitation. I'm talking of those patients, families who cannot afford to send them for residential care, or they want to care for their person at home. So this is the module which we use, and we are all willing to train them at a very, very nominal cost.
Now, Dr. Sushma, I had a question in terms of, you gave the statistics that roughly 1 in 20, about 5% of people above 60 and 20% of people above 80. But let's say if you take the people above 60, 5%, it's still a huge number. And most of their sons and daughters would be in some profession, some work somewhere. So I would therefore think that corporates will be a huge stakeholder in both this awareness and helping the employees. What are the 2 or 3 things that you would suggest corporates do? Is memory clinics one of them? And obviously awareness sessions would help. Is there any suggestions in this regard? Because quite a few of the corporates may be probably watching this program.
Yes, we need to do their memory assessment.
Mm-hmm.
Above the age of 50, we need to do their memory assessment. Just identify the underlying diseases, advise them to control their diabetes and their hypertension, because mostly these are the underlying diseases, and guide them to lead a very healthy lifestyle. Now, in the memory clinic, they need not come. They need to come only after 3 months, when if they have done those cognitive retraining and rehabilitation. What we need is we need daycare memory centers where we stimulate their brain. A 50+ person can come and be a guide to all those. He will stimulate his brain also, and he'll stimulate the brain of the patients also. Identify the exercises which will stimulate their brain. Somebody can volunteer and hold on music classes for people above the age of 50 or those who are having some cognitive impairment. So we need to do a lot of work on this to keep them healthy, full of dignity, and within the society. And as I mentioned you earlier, that for that we need to have a extremely friendly, dementia-friendly society. कि अगर कोई कम सीख रहा है, अगर कोई गलत नोट्स भी बजा रहा है, गलत गा रहा है, या अगर उसको याद नहीं रह रहा है, we should encourage them.
Understand. So this
is what is needed. The memory clinic, the daycare activities you have seen in my small video, those type of centers are needed in every pocket of the society. Every pocket, like it is in V4 in Delhi, in 𝒊𝒔𝒏𝒕 enclave. It is needed in V2 also. Maybe not in V3. It is needed in A block also. So that they can go themselves, they can walk up to that place and get involved into the people who are almost of their same intellect. Like I had one lady who said that I am from IIT and she was suffering from very mild dementia, going on to moderate. The family had got it assessed. Now she said that these activities, coloring and puzzles and everything, these are not for me. I am from IIT. Oh. She refused to be one amongst them. And I know that she is suffering from dementia. So we told her that you are not to do these activities. You have to design the activities for these people and help them. So we put her immediately on the other side of the table. And now she's doing very well. She's teaching people. She's helping them draw. She's helping them sing. And she herself also sings. आज का मेरा काम खत्म हो गया, अब मैं जा रही हूँ. And her daughter says that my mother is a different person after joining your center. Wow. Now that is satisfying for me, but I want that these type of centers should be all over, available to everyone.
So
very
so a lot
affordable.
Of awareness, a lot of investments have to happen.
No, it doesn't cost much. If you start a daycare, somebody can come forward with a small 1-bedroom or 2-bedroom flat on the ground floor, and you can pay very nominal rent for it. You know, we need to have people who are senior citizen friendly, sensitive to their needs. We need to bring them in. And it is not very expensive. Like for daycare, we are charging them just 15,000 per month. Okay. We reduce the charges in some patients who are very finicky and they say, "Itna to ho hi nahi sakega." We reduce them. But yes, to give them lunch, to give them snacks, to arrange for all the activities, and to pay the volunteers, pay the counselors, we do need some amount of money. And I tell you, Raghu, if you give everything free, it is not even...
it won't be value.
No value to that. So charge, but charge less. It should be affordable.
Sure. It's a great service you are doing, Dr. Sushma. Just
I
one
want to
last
do
question.
Everywhere. You start a daycare center there, I'll come and train your batch there.
One last question from my end. a little uncomfortable question. You said by and large it's irreversible, other than, let's say, B12 deficiency or dehydration and so on, right? The disease is irreversible, and there's no real cure, but we can manage it better. But how long do you think will a patient suffer after diagnosis before the inevitable happens? Is there a pattern to it?
That's a very tough question, but a very good question also. Unfortunately, I have read some data of Japan where people live very long. Unfortunately, dementia patients still live long. So in most of the patients, I have seen anything between 10 to 15 years. The family keeps caring and gets tired. Some of them can manage, some of them cannot. They do live long. And if they have got underlying comorbidity, they may die early. And the cause of death is never Alzheimer's disease. It is the underlying secondary infection due to bed sores or due to pneumonia. They are not managed well, and that is the cause of death.
Yeah, Raghu, just additional what Dr. Sushma said. Yes, about 10 years or 12 years, the first 7-8 years may not be that bad, but the last 4-5 years are extremely bad. Number one. Number two, my observation for the last about 15 years, that the ladies have a prolonged period, whereas in the last about 7 years, I have seen the gents, they have a relatively lesser time spent under this deadly disease. But the females, I don't know, I'm asking 2 of the girls from the psychology field to undergo a PhD study. The ladies have a much longer period of suffering.
Because
I don't know whether Dr.
It is
Sushma.
more common in women. It is more common in women because they lose
not
their
only common, it lasts much longer. I have known about 4 gentlemen suffering for about 5 to 6 years, but I have known about 15 ladies who go beyond 10 to 12 years in Nightingale Medical Trust. Because with them, my last association has been now for about 17 years. So this is another area. I mean, it's worrying anyway, but it's there. It's there. Yeah.
Rima, are there any other questions on the chat?
There is one which, so the gentleman is asking, does spending too much time on social media improve or decrease memory? Does it impact your memory?
I don't think any studies have been done on that as yet. Because Alzheimer's being a latest disease, so nobody would have done that whether it has got an effect on Alzheimer's or not. That is my take.
Social media influence is quite recent. Okay, I think we are now 10 minutes over time. I'm sure there are many more questions because this is something that we are just trying to start thinking about and looking at. So thank you, Dr. Sushma. Raghu, do you want to add something? Otherwise, this is the closing.
No, thank you so much. I think it was very informative. I learned a lot. And some of the tips, especially around the communication and the way you handled the IIT graduates example, it's really eye-opening in terms of not just the understanding, but the empathy and the way to get their cooperation and help them. And of course, the entire information about the disease was very helpful. So thank you once again, Dr. Sushma.
Dr. Sushma would like to add something. Yes, Dr.
Yes. Go ahead, Dr.
I want to answer your question. What about social media? Here I would like to say, Rima, excess of everything is bad.
Sure.
You sit down, and I have seen a gentleman sitting on the couch for hours and hours together, engrossed is in social media. Okay. And that is his everyday routine. So social media may not affect him, but his sedentary lifestyle might affect. So excess of everything is bad. be interactive with people. It is better to be physically interactive and not active on the social media. Use it for your profession or say hi to long lost friends. Otherwise, go and make physical contacts with your friends who are approachable.
Very well said. Thanks once again, Dr. Sushma. Really informative session. And just before we end, again, as I mentioned, since the caregiver takes the most load, responsibility, and the stress of managing this disease, we'll delve deeper into it next week, same time. Do attend that as well. Watch out for the notification and do make sure you join them. Thank you once again, and thanks, Wing Commander Sabharwal, for stepping in to add more light with your experience as well. And thank you, Sushma ji. Thank you so much. Thanks, everyone.
Thank you
Thanks
very
for
much.
joining.
Thank you, everybody.
Thank you very much.
For those
Thank
who
you.
have joined us today, thank you so much. If you would like to know more about the caregiving aspects, like Raghu said, do join us next week again at 11:30.
Sure.
There'll be a fresh link for that, which will be put up on our handles. Thank you.
Thank you.
Okay. Thank you. Thank you very much. Bye, everybody. Bye-bye.